Hi friends, it's Ryan, the Friendly Designer, and welcome to another episode of our Friendly Podcast. This podcast is all about exploring friendliness and getting a better understanding of what that term means in our pursuit of building a friendlier world. Today, our guest is Dr. Yoshi Rothman and Aaron the Caterpillar, one of our favorite friendly sculptures. We're going to talk a little bit about his career in the medical field and how we can maybe inspire a bit more friendliness there. So, Yosh, buenos dias.
Buenos dias.
What's up, brother?
What's up, brother?
Let's get some furniture going out
Let's
here.
do it.
The caterpillar's turning into a butterfly.
We're making her prettier every second.
Ooh, good morning. I'm in my fort. Yoshi's on the sideways rocking chair.
Living the dream.
Living the dream. All right, brother, first question for you. What does friendliness mean to you?
Friendliness is... The keys to friendliness are vulnerability and trust. As a pediatrician, before any sort of medical evaluation, I prioritize connecting with my patients.
Yeah.
So when I walk into a room, I don't even touch the computer. I make eye contact and I give them my full attention. This creates a space where they feel comfortable, they can trust me, they can be vulnerable.
Yeah.
And guess what? A smile really goes a long way.
Do you hit him with, I'm Dr. Yoshi? Mario!
Every now and then I go, I'm Dr. Yoshi.
Like you throwing eggs out when you're on the speed cart or whatnot?
Let's go. Let's go. You know it.
All right, so trust and vulnerability are two of your kind of primary focuses on the term friendliness, and you apply those to your work every single time you're talking with the patient. Huh, very interesting. So I feel like that's one way you're able to bring that friendly atmosphere into the hospital. So I want to start out the conversation by what are the most friendly things you see about your practice in the hospital you work at now and where you did your residency, if you want to share the experience you had in Philly at the Children's Hospital versus here. But what are hospitals getting right when it comes to being in a friendly environment?
That's a good question. So when I think about friendliness in the hospital, I think about where are there spaces where people can connect and have a good time and have fun, right? I mean, these are kids. They're pros, right? They're pros at friendliness. They're pros at having fun. So hospitals that have created those spaces. So I'll give you an example. When I was in Philadelphia, they have a garden.
Which hospital?
The Children's Hospital of Philadelphia.
Got it.
They have a garden outside that actually also has a basketball hoop. And I can think of this specific, Kobe, this specific situation where...
Hey friends, it's Ryan, the Friendly Designer, and welcome back to the same episode of our Friendly Podcast. Dr. Yoshi had to go, you won't believe it, to the hospital because he's a doctor and he does important things. But we're back another morning. He's taken off one uniform. He's put on his Friendly Futures uniform. What's up, alien?
Let's go.
So Dr. Yoshi, welcome back to the podcast.
Sorry for the brief interlude, but keeping the kids safe. So.
Keeping the kids safe. All right, let's whoop Aaron out. Sick. All right, so I believe yesterday we kind of left off on what are some things that hospitals are doing right in terms of promoting a friendlier environment.
For sure. So one example that I wanted to give to you was when I was back in Philadelphia at the Children's Hospital of Philadelphia, there was this outdoor garden space that was accessible to one unit of the hospital. And there's plants and there's also actually a basketball hoop. And whenever I had free time, there was this kid who was in the foster system who actually was just kind of stuck in the hospital because he had nowhere to go. And so I would just head down there, grab him and be like, hey man, you want to shoot some hoops?
Yep.
And I thought to myself, why can't we do this with more patients? Why can't we have more patients and families interacting in spaces like this that can really promote healing in a completely different way?
So I feel like I often read reports that show a correlation between stronger community ties and better health results, right? And also in general, play often associated with like kind of community ties, especially for children. So does it seem like in your anecdotal experience and what you've seen academically that research holds true, that like there is a correlation between better community ties and the purpose associated with that and better health outcomes?
Absolutely. And one thing that I think about is there's two ends of the spectrum, right? So something we talk a lot about is ACEs in the pediatric, health literature. So ACEs means adverse childhood experiences, which those have negative effects on a kid's health. But the opposite is also true. So positive childhood experiences really promote health and healing and overall well-being. And so community promotes those positive childhood experiences, but also, just we probably underestimate the effect that has on our physiology
Yeah.
and overall treatment of disease. You know what I'm saying?
So you bring up the example of the Children's Hospital in Philly where they had a basketball court in the courtyard and just how much that small design intervention was able to do. But it seems to me that most hospitals are let's say to be generous, are overlooking the benefits that some more communal spaces within their campuses could kind of produce for their patients. Why do you think that is, and where do you think are some of the main areas a hospital could kind of improve its physical structure or its programming perhaps so that it's a less depressing place and better suited for healing?
Totally. Obviously, hospitals are not trying to create depressing spaces.
Yeah.
But if you think about how healthcare has evolved in the United States and elsewhere, it's really been more about treatment of sick people, right? So you want to have a sterile environment. You don't want to have a risk of someone getting an infection or something like that. But I think we need to flip the script. I think we need to be, hospitals need to be places where we promote healing, where we prevent disease, right?
Yeah.
We need to create spaces where people can interact and create health in that way. We need to create spaces where people are moving and exercising, and
For sure.
and doing those positive activities for their bodies. And what better way than creating, for example, a waiting room where instead of having like just like an aquarium and books and things where people are for kids, where they're in separate spaces,
Yeah.
where they can interact and play and learn, for example, using something like this, where
Yeah.
kids are testing their environment and learning from it and interacting with other kids. I think that's what we need.
I mean, I always think of like a hospital as like just like painted white walls, sterile, scary.
Totally.
You get in there and your heart rate starts to go up because you're like, oh my God, like something's probably wrong with me. I'm about to discover it. Yikes. And the environment just is like, I'm in my chair on my waiting room. I'm definitely not talking to anyone else that's there. And I'm just like, oh my God. And then someone takes my blood pressure and they're like, it's
high.
really high. And I'm like, well, it wasn't like 10 minutes ago. So the waiting rooms, you think, are opportunity spaces. Are there, because I feel like a lot of hospitals are kind of campus oriented. So are there outdoor areas where there's opportunities to promote spaces? And maybe it's also the medical professionals that are there too, because if they're feeling more on their A game, they're going to probably be able to help their patients more. Like my cousin's a nurse, and she just seems constantly exhausted, right?
Yeah.
And not, it seems like her environment is not necessarily optimizing her ability to be a healer.
Absolutely. There's some hospital systems that do prioritize outdoor space, community space, whether it's for patients or staff,
Yeah.
and some do both, which is great, but I think we need to take it to that next level where it's not just having the space, but making the space interactive such that you can actually promote that healing or that preventative power of play.
Yeah. Real quick, I want to sit over there. Let's switch sides. I'm just looking at that, and it's just.
It's feeling good.
Wow.
Oh, that is something.
I needed that.
Totally.
You going there? Where are you going? Oh.
Ooh. Yeah. Uh-huh.
My last question for you
Sure.
is working in pediatrics and thinking about how we can potentially transform some of the spaces at the hospital to get better health outcomes. Do you think the conversation we've had here today is applicable towards adults as well, and the kind of hospital systems that we set up for them? Because I imagine they're even duller than the kid spaces.
Well, I think what we're doing here with Friendly Futures is creating intergenerational spaces where people can interact, build community, and play.
Yep.
That would totally apply to a hospital, to a waiting room. I mean, think about this. There are kids who are playing and learning and laughing and growing together. Why not have elderly adults who can be there too, and who can, read books to them and can supervise them and who can play with them?
You know what would be good for old people in the hospital, which must be such an isolating and challenging experience, is having a bunch of children running around that they can commingle with, and that would bring a joy to life and more purpose, and they could educate them and help them out, and the kids are having more supervisors and more fun, and it makes sense.
It makes sense. I think we can't wait. We need to do this now.
Yeah.
Our population is aging, like you talk about. We're fighting an epidemic of loneliness. Let's bring community to the places that we feel are lacking health.
Yeah, and especially like hospitals where
Exactly.
the purpose is to heal. Like that's the
Exactly.
purpose. So I like the points that you bring up today and the spaces you've identified as, hey, this would be value for the hospital in their kind of overall picture of let's have more health in our society. So one step at a time, baby. I'm fired up.
One step at a time.
I'm fired up.
Let's change the conversation. Let's promote prevention and community and not wait till people get sick.
Dr. Yoshi, it's been fun.
Always a pleasure.